Great. Okay. So this is the second free talk on the chronic pain. And thank you for participating live. And thank you also for those who are listening to the recording afterwards. It is for me a great opportunity. It's a personal opportunity to share what I know and what I found in time that helped people, really helped people with chronic pains, with dysfunctional, with syndromes, with suffering that is long-term and usually does not respond very well to normal medical procedures. While I am a Western educated doctor and I have great respect and appreciation for all medical procedures, I know that there is more to it, more to treatment than the medication, than the medical interventions. And this is what I did. This is what I studied in the last many years. And I would like to share this experience. Especially at the bridge of Western medicine, traditional medicine, as well as integrative integration between medical science and spirituality. I find that the late development and the spiritual longing of people makes such a difference in the quality of life and also in the way diseases evolve, in the way we manifest our symptoms, in the way life unfolds. And medical science is clueless about it because simply doesn't have, it's not in its object to look into these aspects like what on earth is spirituality or religion or spirit. So we want really to integrate, and there are lots of studies actually in the science, in the medical science, proving the importance and trying to convince the medical environment about the importance of paying attention to the meaning, the principles, the values, the importance, the presence of the sacred in the life of the sufferer, in the life of the people who are actually suffering of chronic pains, and not only of all diseases in the world, of all processes. So this is where I developed my work, where I studied in the last years. I worked with spiritual communities along the world, and I discovered that there are similarities and there are also a lot of differences that also make me go into the direction of personalization. Like, yes, there are theories and there is also a practical application. And when it comes to practical application, what the individual needs is most important. So a brief overview now. I'm going to share the screen and go through a few ideas that I touched briefly in the first free webinar on the chronic pain. It's just a summary of the things that all. If you feel that it's not clear for you, please feel free to stop me and. Sorry, I'm doing many things at the same time. Yes, stop me and ask for more details. Yes, so that's most important. Okay, so I was first presenting this. Okay, this is how it goes. I gave the opposite. Okay. First of all, chronic pain. What is the chronic pain? Pain in itself is a signal of warning, a warning signal that is overpowering our brain, overpowering our nervous system and our attention, focuses our attention. Naturally, I may emphasize, naturally focusing our attention on the subject, on the cause of this pain. So it is very powerful in itself, naturally, but it is mostly meant to work when it comes to acute, when it is when there is an accident, when there is an event that stops us from doing something. So then it becomes chronic when it stays for longer than 3 months. This is the definition, the medical definition. Yes, it is longer when it stays longer than 3 months. But unlike the other chronic diseases, chronic pain has this problem of being an experience that is real but invisible. It is very difficult to measure. It is subjective, and it becomes a disability. It gives to the person a feeling of powerlessness in relation to the time of return, to the characters of pain, in the way it influences our relationships, and very often it is a place of testing. It is a point of testing for a person who is in a practice, in a spiritual practice. And it is a testing in terms of relationship with God, truth, the universe. And this testing, like, what is the meaning of this pain? Why is it in my life right now? What are the karmic implications? What are the sins implications about this? About this pain, about this suffering, can make the pain become worse, can aggravate the symptoms, or can actually bring responses, reactions, and even amazing healing. So I was saying that also last time, I was insisting on the fact that the assessment tools that we have for the pain, I like other testing, medical testing, is very difficult. It's purely subjective and is very difficult to objectify. And medical science, medical doctors in general, have difficulties in identifying, measuring, and believing the level of pain that their patients have. Yes, so because of this, medical science opens up towards other direction of approach, of testing, of measurement of pain. And we will see amazing, in this presentation, amazing reaction, amazing situations where pain is actually something that is experienced in totally different levels in spiritual environments. So pain is a sensation, and most people, when thinking about pain, they think as a sensation. Yes, it is a hurt, a discomfort, a distress. Something is injuring either physical, emotional, or mental, and it is producing a hurt, a discomfort, a distress. But actually, pain is a processing activity of the brain. There are a lot of experiences. Oh, sorry for that. That's an auditory pain that you have been exposed to. And the better my microphone, the worse, I guess, the pain it is. So apologies for this. So this pain is sensation, and sensation is sensitivity, is perception, is the passive part of the pain. But the processing of pain is the yang, is the active, is the involved. It is the place where we have a chance to do something about. where we can interfere, where we can intervene, where we can change and produce a lot of change. And I was also presenting last time, and I was sorry I didn't have this slide about the somatosensory cortex. This is how the sensations in our body look like on the brain. So they are processed in these areas of the brain, and they look like a homunculus. They don't look like us. They are distorted according to the intensity of sensitivity of different parts. This is why you see we have very big lips and tongue and hands and genitals, for example, and head were on the pain areas in the brain, because here we perceive the sensations stronger, more frequently, more in more details. So when there is an area which is painful for long periods of time, that particular part of our body on the brain increases even more. Yes, so this makes it that chronic pain is going to have a reflection on the brain, on the sensitive parts of our brain, that makes that area is growing. Thus, whatever sensations are going to be transferred or are going to be processed in that area of the brain, they are going to take more of our attention. They are going to involve and trigger more of our resources, and consequently we are going to feel it deeper and stronger, and we are going to act in a much bigger, much more intense way, simply because there are more neurons and more sensitive areas in the brain that act when that pain is perceived. So this makes it that chronic pain is not just in our head, like in our psychology. Yes, it is actually in the nervous system, has a physiologic background. It is a disease. It becomes a disability. Nevertheless, one that cannot be measured properly. So in the process of treatment, one needs to act on the psychology, on the sensation in itself, and also on diminishing the neuronal connections, the weight, the area, the length, the projection in the brain, this sensitive cortex conditioning in the brain. This is why it takes longer time for chronic pain to be shifting. Nevertheless, it is actually, when it happens, it can happen suddenly. It can happen, it can shift, the trigger can shift suddenly, because we give it another meaning, another connection in the brain. We connect it with different areas of processing in our brain. And this is important to understand, because very often people lose faith, people lose patience in their process. Even this week I was working with a client of mine, a woman who started a process of holistic treatment, and she was traveling this time of healing that is symptoms. Her body is not yet adapted to a new level of health, and consequently she's in the middle of nowhere. It doesn't feel much better than before. She does not want to go back. She cannot go back to before, but she doesn't know if she's ever going to get better. Yes, it feels like in the middle of nowhere. It feels lost. Well, every patient, every client, everybody who is in some chronic pain or dysfunctional syndrome treatment is feeling the same and is going to feel the same, because this is the time of accumulative accumulation, of quantitative accumulation, of change, incremental change, neuron by neuron, connection by connection, constantly doing the practice, like in the yoga practice, like in the meditation practice, like in prayer practice. There is a beginning stage where there are changes, amazing changes, and then there is a middle stage where it feels like, oh, nothing is changing, maybe I'm doing something wrong, maybe the treatment is wrong, maybe I need something else, maybe I need another asana or another initiation or another meditation or another cosmic power or another prayer or another priest or another teacher or anything else, just to make it shift, just to make it change. Yes. So this middle time of shift, middle time, change time is going to be there, and I want everyone to know that is there and to not lose hope during this time, to continue doing, to ask for guidance. Yes, because from outside it can be seen, like I could see in my client, I was telling her, look, it is clear that you are evolving, look, there are this and this and this changes, but they don't feel like the end, they don't feel like a good ending for you, because you don't have from inside the bigger picture of what's going on with you, and you are tempted either to go back or to change something, which both of them are not real solutions. Yes. So the somatosensory cortex in our brain, it is changed. It is relevantly changed. You can imagine that on this homunculus, in the case of chronic pain, there is one area which is disproportionately bigger, because that is the area which accumulates the pain sensations from that injured place. And that injured place can be physical, can be a post-surgery wound, can be, I don't know, menstrual pains, can be emotional pains, can be mental pains, can be spiritual pains, can be energy-like pains. So there are internal amplifiers of the pain perception, cognitive, contextual, mood, depending on personal sensitivity. I gave also certain examples, practical examples that I have seen of chronic pain, back pain syndromes, in which the changes, the causes of these pains are actually not present on the test. Only 15% of all back pain has an actual change, like all the degenerative disc diseases, the slip disc as they are called casually, the subluxation, the scoliosis, osteoporosis, pinched nerves, and so on. All these structural causes for pain pertain only to 15% of all back pains. All the other 85% are considered non-specific, and most of the time they go through a lot of treatments, structural treatments, including intensive testing and surgeries, just because it is not possible to identify what is the structural pain, and they are non-specific. The same is valid for the knee pain with different numbers. And I was also insisting, and here is a place where I was running a little bit over last time, that understanding the pain can lower it. So the first practical element that I want people to stay with, and I have seen it in my practice and in the experience of chronic pain sufferers, it's most important, is staying with the pain rather than running away from it. When the pain stays for a long time, or unpleasant sensations stay for a long time, our tentative is to run away from it, to take painkillers, to take do things that distract our mind, to go with different intoxicants and so on, just to run away from pain. And then I ask people, how is your pain? Tell me the character of your pain. Is your pain sharp or wider? It is your pain cramping or aching? Is it your pain internalized or externalized? Is it your pain? So, and people are usually answering is like, that's a good question. Never thought about it. And why never thought about it? Because of an instinctual reaction of running away from unpleasantness, from running away from suffering. Actually, staying with the pain, looking into the pain, helps us understand it. And understanding the pain can lower it without a painkiller. So the first painkiller is understanding the pain, understanding the character of pain, the patterns of pain. Nobody has pain 24/7. That is incompatible with life. So then, looking into the pain and understanding, when does it come? When does it go away? What makes it better? What makes it worse? Is an important practical element. One of the first things that we can all do. That's the first painkiller. Yes? Looking into the pain, having a pain journal, putting down and finding the patterns. And then from finding the patterns, we can actually understand even deeper the pathology behind that pain. So in yoga, very often we jump, for example, into this, there is a back pain, do certain interventions like stretchings or what kind of miracle posture can be done, what kind of adjustment can be done, what kind of breathing can be done, what kind of core stabilization. And there are a lot of theories about core stabilization in yoga therapy. But studies performed attention on 4,000 soldiers are showing that the psychosocial education, understanding the pain, education, reduce more the incidence of low back pain than core stabilization, than training in itself. So this can be applied by everyone, regardless of knowing a miracle posture or a miracle treatment or a miracle painkiller. It's one simple thing. Pay attention to the pain. Pay attention to the pain. Yes. The example, the metaphor that is given most often in the integrative medicine and in the contemplative studies is the situation of an injury, of an attack. If a person is attacked and by a dog, and the dog is grabbing the arm, for example, what is the first instinctual reaction? Retract, go away from that grip, from the bite of the dog. But if you do that instinctual reaction, what happens? The teeth of the dog are already in the flesh, and then the injury becomes worse. There is tearing apart of the flesh. So then the non-instinctual and actually even more efficient reaction is to do the opposite, to push into the aggressor. Pushing is going to first produce a surprise because no attacker expects such a reaction as an instinctual first reaction, and then is going to produce pain in the teeth of the dog, and it's going to open. It's going to open instinctually the grip. You are going to be left with the teeth marks, with the injury, but the flesh, the tissues are intact. The flesh, the tissues are not torn apart by that movement that you do of retracting. Yes, we are designed instinctually to retract when having pain. Yes, like in that image that I was showing you before, like in that situation with this touching heat, touching the fire. Yes, when touching the fire, retracting automatically is instinctually wired in our brain, and it is necessary, but is not acting in our best interest all the time. Yes, so here is where the metaphor of the dog bite comes and tells us at times it is better to look into the pain, to go into the pain, and that is going to bring much more relief and much better result than running away from it. The same has been discovered in a different format, different kind of studies on musculoskeletal pain disorders. Yes, and they are speaking about compelling evidence about the educational strategy addressing the neurophysiology and neurobiology of pain. Yes, the pain in itself is more than physical, as I was saying. There is physical pain, but around that pain, physical pain, we build up emotional pain. And then emotional pain can be produced in itself by grief, by attacks, by external circumstances, by the way we react to the external circumstances. And last time we had a very, very deep talk on the emotional pain and the importance of it. There is intellectual pain. And here I was bringing this quote of an African-American writer who are really saying thoughts can hurt like real pain, because our brain cannot make the difference between the thoughts as painful and the external pain, the injury, the physical pain. It processes pain sensations in the same way. Either the stressor, the agent, the hurting agent is internal or external. The sensation inside is as hurtful as our internal processing. So the pain is intellectual pain, mental pain, emotional pain is as painful as physical pain. And then there is the concept which slowly enters also in the medical environment of spiritual pain. And then we encountered a lot of energy-related pains. Situations of, I remember situations of nadis blockages or toxicity manifesting on an energetic level, or Kundalini manifestations in a body that is not yet prepared and having uncharacteristic pains and non-specific syndromes, and doctors, neurologists being completely unknowledgeable. We don't know what to do with this kind of pain, and these are pains produced by spiritual practices, but of all kind, yoga, Kundalini yoga, but also Taoist practices, martial arts practices, meditative practices. So a lot of this I have seen in time, and they are not identified. I have seen a lot of people, for example, experiencing what is called interstitial cystitis a non-bacterial urinary tract infection that will arrive after tantric practices in people who are developing their energy bodies, or putting a lot of energy into their body as post tantric sexual practices, without those bodies being purified and acting before those practices. And I was dealing with this because they do not respond to antibiotics. Most people actually jump into antibiotics when it comes to cystitis or urinary tract infections, but especially in these cases of interstitial cystitis, non-specific cystitis, they do not respond to antibiotics. And actually the whole general health is going to be aggravated by the repeated courses of antibiotics that are prescribed on a normal basis, it's just, you have a little bit of burning urination, the GP, the normal doctor, will just prescribe some antibiotics and that's it, That is wrong. That is wrong, because very often actually this urinary cystitis are related with something else than a bacteria or an inflammatory condition. So thoughts, but also energy, yes, can hurt as like as. So here I come back to a more intensive meditation on the sensitive versus the processing activity that is involved in pain. Pain is not only an input, something that comes from outside in, but it is rather an output from the brain towards outside. It's what our brain processes and decides and acts, leading our mind and the body towards the next steps in life. So what to do about that pain? So this is an important thing to understand, because the approach towards pain as a sensation, a hurt that depends on others or on an injury that came from outside, leaves us powerless. But this piece of physiology, of body, of embodiment, helps us empower ourselves into dealing better with pain. A lot is aggravated in pain, and pain treatment, by what is called catastrophizing or catastrophization. Being overly worried about pain, meaning misinterpretation of the pain sensations, exaggeration of the pain sensation, generalization of the presence of pain, overthinking in general. Yes, it is a triggering and aggravating factor for any kind of pain. There have been studies performed on pain sensations in very advanced meditators. So the researchers will put people who have no experience with meditation in an fMRI machine, a functional medicine, a functional MRI machine that will check the quality of the brain reactions to pain. So people will be put in this, and during a 10 minutes testing, they will be told that there is going to be a sensation that will come. They will be there with the palms on a plate, on a metal plate. And they will be told that at one point during those 10 minutes timing, they are going to experience a pain, like the metal plates are going to heat up very fast, and they are going to have a short short pain sensation. But nobody knew when that is going to be. It could be in the beginning, in the middle, or in the end. And then they put people with no meditation effort, no meditation experience, and very advanced meditators in the same experiment. And they noticed in the people who were non-meditators, they were constantly, the brain was constantly afraid. There will be anxiety. Pain is coming, when is going to happen? What if it's now? What if it's now? And then the pain comes and it's like, whoa, it goes, all the brain sensation, brain activity goes very high. And then it stays higher. It's like the sensation in itself drops because it's a very short breath. The pain sensation drops, but then the brain keeps on processing. Wow, that was so bad. What a mean thing. What did they mean? Why did I participate into this experiment? And what if it's coming back again? What if they didn't tell me that it's going to happen again? Blah, 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 blah. And the 10 minutes are gone. While in the people with experience with pain, there will be quiet brain, pain. So the brain perceives the pain at the same level and even higher because they are very sensitive. These are brains that are more sensitive than normal. And then after the pain sensation disappears, it's again quiet. Yes? So it's pain, up, pain, quiet. Yes? So there is nothing. Well, that is an example that tells us the importance of catastrophization, the importance of the overthinking in terms of pain. Yes, the pain is going to come back, but it depends on us when. Please, I see a hand up. Please, Nikki, unmute.
Yeah, I wanted to ask, is it something similar what we can experience at the dentist? When I go to dentist and I'm already in this state that, oh my God, it's gonna be painful. I'm sure it's gonna be painful. So yes. What you are saying is that if I am getting a little bit better with meditations, can I bring also all the stress and pain at the dentist a little bit lower?
Yes, correct. It's going to, and it's not about the need to do a lot of meditation. This is not the point. The point is in being mindful of the process, of the quality of thoughts that you keep while you are going to the dentist. Yes, because the anticipation is the problem. And also the overthinking afterwards. Meditation is the one that is training our brain to not believe our thoughts, to shift our thinking into the presence, into mindfulness of what is going on in daily life, what is going on right now. Yes. So don't think that you need extensive amounts of meditation in order to do the same. Yes. Of course, that is a side effect of meditation. Yes. But what you can do at the moment, at this time, and it's available, is to consciously look into your mind and not believe everything that the brain is going to give you. Those are thoughts, the fear, the anxiety. Yes, that is going to be pain. It's going to be pain, so what? Yeah. So I always remember my sister is a dentist doctor, and I was, of course, going to her. She will extensively work on me, and very often I will fall asleep during her treatments because I was working with this. I was using this time to work with all this anxiety, to work with all these worries in the brain, and then the mind will be very quiet and find itself a relaxation. So I'll go in meditation or in, and this does not mean that there is no pain. There is pain, but that pain is not amplified by excessive overthinking. Yes, that's the point. That's the point. Any other questions? Any other? Okay, I'm going to shift again. Going to share back screen. Okay. So I found this quote from Rumi really relevant for what we are saying. The cure for pain is in the pain. And that is like a motto. The cure for pain is in the pain. Nevertheless, one will still need painkillers when it comes to chronic pain, because maintaining very long periods of pain, like physical sensation, can aggravate the pain. Still, we need to look into the pain and make a good balance, find the best balance between the pain sensation, like reducing the pain sensation artificially, when working on the pain, like the therapy of the pain. And here I come to the specific aspect on spirituality, how spirituality can help us with dealing with this disease of disability of chronic pain. All great spirituality is about what we do with our pain. If we do not transform our pain, we will transmit it to those around us. And this will destroy our relationships and will destroy also our path, will destroy our efforts, will become an identity. In yoga, we have this klesha of aversion. Klesha is an affliction. It is considered an impurity. It is considered the original affliction that produces suffering on a certain level of consciousness. And for those of you who are in yoga and know about the chakras, this is in the traditional yoga, it is the klesha, the specific toxicity and impurity or in affliction of Svadhisthana chakra, of the second chakra. And the affliction that results from memorized suffering is called aversion. This is a sutra from the famous Patanjali Yoga Sutra describing the klesha of dvesha, aversion. Aversion stems from pain, yes? So very often acting on averse to pain and averse to unpleasantness, aversion in itself stems from memorized pain, from a lack of work on pain, from running away from pain, from finding a form of intoxication, just a form of forgetfulness about pain. And in time, so pain, running away from pain, becoming averse to pain, brings us also to a certain kind of identity of the aversive person, the person who is always revolutionary and angry and always reacting in an adverse reactivity and reacting in a way that is disbelieving and aggressive to those around. And that identity is going to be brought also in the spiritual environment. And you will see people who will be all the time bringing revolutionary reactions. No, this has to be changed. Life has to be changed, and repent and repent. All this aversion is already an identity that was built up from a lack of proper processing of pain. Pain is going to be present in our life unavoidably, in different formats: physical, emotional, mental, spiritual, energetic, in every kind of pain. If there is one thing that is sure, pain is going to be present. Yes, even if it's only the pain of final demise, of death, and still is going to be present there. So running away all the time from pain and overthinking about pains are not the solutions. Yes, but a proper processing of that pain. And I insist on proper, because staying too much with that pain is also not a good solution. This is why we need guidance. We need discriminative knowledge. Yes. So a form of wrong cognition, of wrong perception, of wrong processing of pain can bring one to spiritual testing, spiritual challenging, to spiritual blockages in their practice. Yeah. And I have seen it in my life a lot, and I have seen it in the life of my patients, of my clients, and of a lot of spiritual practitioners. Now, yoga and meditation, this is another diversion from medical studies performed on meditation, like our brain on pain. So there is pain. Yes, there is pain. We can see that there is pain. Yes, but this pain is processed differently when the brain is in meditation, has a training on meditation, or is just in a restful condition, like we can see here in these two images. So people are processing pain totally different. Yes, and this is, groin pains, yes, are horrible. And look at this Taoist monks. Yes, they are just, this is a training. Disclaimer here: please do not do at home. This is not something you try at home, not on your boyfriend or on yourself. Yes, because it takes a lot of training for these monks to be able to stand this kind of pain. It's a very sensitive pain. But an important take from this is that the level of perceived pain is not related to the gravity of structural damage. Yes, we are most of the time afraid, what happened with such a strong pain, and I will never have kids again. Yes, I will be impotent or something. Yes, there is no structural damage in most of these situations, but the perceived pain is excruciating. The most painful pains, for example, have minimal structural damage. The most painful pains we can perceive is a paper cut. Did you ever cut yourself in a paper? Yes. While famous example of awful structural damage came without a pain. This is an extraordinary example of Phineas Phil. He's famous. He just walked into a hospital, into a practice, with this rod in his brain, Imagine coming into a medical clinic with a rod piercing the brain and having no pain. And there are a lot of such examples of people who came in the emergency room with a bullet in the brain and they felt nothing. Yes. So the pain, the perceived pain is different than the gravity of structural changes. There is a lot here, a lot of extremes, yes, between insensitivity, not processing pain properly, but also being in a state of mind, in a condition of the mind that is impervious to pain. Like, look at these examples. These are normal people. These are photos taken in the Phuket Vegetarian Festival that happens every year in Thailand, every year in October in Thailand. People go a certain kind of ritual that puts them in an altered state of consciousness, and then they pierce their body. Like, look at that. This is not Photoshop. You can give a search on internet on Phuket Vegetarian Festival and you will find endless photos like this. Yes, because normal people, like, look, girls, they go into a certain state of altered state of consciousness. They pierce their body. There is no bleeding. There is no pain. And actually they are going into experience a state of a sort of ecstasy. Yes. So pain perception and gravity of damage has enormous extremes. It's not the only place that is happening. This is an image taken from a Malaysian festival, Hindu festival, where also women people are going into the same. They learn how to to go into this altered state of consciousness, and everything is devoted to the goddess, in this case Kali, the great cosmic powers of time. So this is a devotion practice, a spiritual practice that changes the meaning of their structural change of the infliction of the pain perception to the level of rendering off, like making the pain disappear. Yes. So, and changing the physiology because there is no bleeding in this case. These are images and things to know, practices that are common. This happens every year in Malaysia, every year in Thailand. You can go and witness it. Yes. So human body has capacities and experiences that are way beyond our limited way of thinking. And spiritual interpretation, the meaning that we give to what's going on in our life, counts enormously. The experience of stigmata in Christian Catholic environment is the same. This is Padre Pio. Padre Pio, who had a real, genuine experience and very painful experience of the stigmata. And I put that quote to see there that his experience of pain was real in the beginning when it started. And there was suffering and there was embarrassment because he didn't know in the beginning what's going on. He tried to cover it. He tried he was ashamed of it. And then understanding and giving it the context in itself. Also the participation, the co-participation in the suffering of Christ brought this phenomena into a totally different domain. East and West, these are examples of how pain is processed completely different when spirituality is brought in. Ramakrishna Paramahamsa in the Indian Hindu environment was considered to be a god, an avatar, and still he died of pain, of the horrible pain. He died of cancer, throat cancer. Look in the lower picture. He was just like a stick, like in his last rites of Ramakrishna Paramahamsa. The cancer was there. People didn't know what to understand about it. And he was asked about pain. The doctor asked him, how do you experience pain? And he said, I feel acute, intense pain. But my disease and I have learned to peacefully coexist in my body. There is no identification. There is no identification between this pain. And then he will go into states of samadhi, states of ecstasy, in which he will say, the pain will fade away and will disappear when I'm in this state of consciousness, and will come back when coming back into the normal state of consciousness. Yes? So pain is present in the very advanced meditators, in the very advanced spiritually enlightened people, because this body, this physical body, is subjected to infliction, is subjected to pain. But the way we interpret what we do with that pain is completely different. This is a picture also from Thailand of a Thai monk meditating in boiling oil. Boiling oil, and this is a practice. Yes, you see the fire and you see the oil, and he is subjecting himself, and there are no infliction, there are no wounds, and there is no perception of pain and no suffering from that. Yes. So there are spiritual interventions to pain. Maybe not all of them are going to make the pain disappear, but they are going to change the meaning that we give to the pain. They are going to help with the disease, and they are definitely going to change the suffering of the diseases that we have. This is why I put up also a masterclass with practical interventions on the chronic pain. You can find more details on my website here, and there is a link to this. Yes, and there is a small fee. I put a small fee to put the engagement into these practices, to give the support for our engagement into this, and commitment to the practice in itself. But actually, what I want is for people to be informed about this other way of approaching pain, other ways of perceiving pains, and other ways of living life and going through a disease without the guilt, without the fear, without the anxiety, without the overwhelming, catastrophizing attitude towards what is going on. And that can shift life, can shift the prognosis of a disease, can have real physiologic and medically testing changes in the way a disease develops, in the way we experience life, and in the meaning of our lives. So this is the subject of, this is what I wanted to say in this free webinar, and thank you for participating again in live. And if there are more questions, or seeing this, if there are more questions, I'm very, very happy to answer now them, or to hear your comments onto this.
I maybe have one question here.
Yes, please, Mickey.
So Maha, we were talking about the catastrophizing, how it can make the pain worse. Does it also work kind of the opposite if I, let's say, ignore the pain because, you know, I don't have time now to deal with that. I have to work, I have to do this, I have to do that. So fuck that pain, and I'm not paying any attention to it. Can it also work in the way that then I perceive the pain less because I'm not putting too much energy on it?
Yes, correct. It works because the focusing on something else, I don't have the time to deal with this pain, and being very stressed is going to produce a lot of cortisol, a lot of hormones of stress, and these hormones of stress have an anti-inflammatory and painkiller effect. Yes, it is like an internal ibuprofen, an internal painkiller. We are not going to perceive it. The problem is that in such a situation, the warning signal of the pain is ignored, and then the disease is not approached. So we don't pay attention to it, yes, but then it's going to evolve, and when will come up, and it will be overwhelming and more difficult to address. So the middle path, like not ignoring, not overthinking, that is what we want to find out. And that is where personalization is absolutely necessary. That is where, like, working with, like, okay, do I need to ignore this, or do I need to pay attention to it? Is this a good pain or it is a bad pain? Yes, it is a warning signal. It is a purification reaction. I should push through my practice, or it is a disease getting worse reaction. So these things is actually what we need to decide. This is where we need to go. And here is the role of a teacher, of a guru, of an instructor, of a doctor, of a therapist, of a healer, you know, to be the one that has the perspective and helps you, you know, navigate this. And also we can work with the internal guide, but that's a bit more difficult. We need the perspective.
Perfect, thank you. That was exactly the second part of my question. Did you just answer, like how to decide when it is good to give it a go? All right, now it's more or less clear. It's probably not very easy. It's something which needs to be learned and trained to figure out when to pay more attention and when to try to pay less.
I agree. It's not most easy. I have encountered this dilemma in my life as well very often, like, okay, what do I do? Do I push or not? And I reach to a level in which almost facing death and looking normal because of a disease. So yes, that's I know this dilemma. I know very well, and this is why I recommend people to trust themselves, trust their internal signals, as well as mirror in somebody who is professional and knows what to do, and also somebody who can navigate the personalized situation, you know. So okay, how about pains that come in people who are on a spiritual path and they are part of their practice? Yeah, so that needs to be addressed with regards of medicine and of spirituality. So, well, that's my domain. This is where I see. This is my perspective of how I see the problem, and also this is my preference. And I like to work exclusively with people who have a spiritual practice, interest, longing, because those are the areas that I can navigate best with people. So thank you for reflecting it. Please, Mel.
Yeah, I have a question really around the Wim Hof stuff as well, because in you know, there's a whole load of different things going on there. I mean, obviously he's practiced it, he's taken, well, kind of a spiritual practices, but not known that, and kind of adapted it, and it dealt with his mental pain. But I wanted to ask the question, is there a level of avoidance in that as well, you know, or is it taking you to a place that allows you to perceive and process? I'm just curious because it's become very big now, you know, doing the ice bathing, ice bathing, and it's shown obviously very good results. But then just talking about what we were talking about, in one way it's reducing inflammation and that, but the psychological pains and the processes there, I'm just wondering, is there a level of distraction from it, or is it allowing you to face the pain?
Well, I cannot say that. I cannot say how much. I asked the same question myself when I heard his story and I witnessed his practices and I did my experiments onto this. I asked the same question, like how much this is a reaction to grief, because it started with the grief of losing his wife. How much is this actually post-traumatic growth, and how much is avoidance? I assume that it is growth, and I cannot say that unless I am sitting in a one-on-one consultation with the person. Yes, so the same methods can be used for growth and for avoidance. And I assume, I have seen actually a lot of men who love this kind of practices, that are applying these practices in a way that is there is a solution, a cover for grief and depression, and the evolution, time will tell. Yes, time will tell. And everybody has their own journey. I believe that Wim Hof is part of his dharma to bring this kind of things here. Yes, and most probably in his case, this is something that is solved, that it's a real growth, a real opening. But I don't know. I cannot know. I cannot know without a personal experience, a personal interview. Yes.
So what you're saying, if I can interject again, is it actually kind of depends on the individual and how they're really treating the approach to it.
Yes.
So in Hof's case, definitely post-traumatic growth, but other people that are coming to it could be a form of avoidance as well. Okay.
Yes. I have seen a lot of spiritual bypassing, like using yoga techniques or meditation techniques or religious principles or non-dualist principles as a fuel for spiritual bypassing. Yeah. And I have seen the results of that bypassing. And I have seen also people who reach to a real healing. Yeah? But that is individual. We cannot build a theory on the basis of this. We only can apply the theory to the individual. Yes, the theories are there, just instruments to be applied individually, personalized way. Yes. Ladies, thank you so much for your online presence. I'll have to go run away for the next of the day. I said I'm not going to be over one hour, and here I am because I love the interaction with you, and I think these are very important things to bring out there, and my soul wants it out, so thank you for participating, and I wish you great health and the best achievement in fulfilling your dharma and your longing in this lifetime. Thank you
very much.
Bye-bye.